After reviewing monthly reports, you identify and report a cluster of serious adverse events after immunization, or AEFIs, in your district. After an AEFI investigation, the expert committee recommends further investigation into potential causes of the AEFIs or a causality assessment. Causality assessments are conducted by an independent expert committee at the national level. As a sub-national or district manager, you may need to provide information for the assessment. Then, you will help carry out recommended actions to address any problems. A causality assessment is a systematic review of data about an AEFI case. It determines the likelihood that the vaccine was the cause of the adverse event. These systematic reviews are a critical part of AEFI monitoring. They not only help identify vaccine-related problems, identify problems related to immunization error, and rule out coincidental events. A causality assessment is critical to maintain the community's confidence in the immunization program. To support and respond to an AEFI causality assessment, you will need to recognize which cases require a causality assessment, prepare the complete case details for the review committee, and take action based on the results of the assessment. First, recognize which cases require a causality assessment. Cases that should be selected for this type of review include serious AEFI, one that results in death, is life-threatening, requires inpatient hospitalization or prolongation of existing hospitalization, results in persistent or significant disability or incapacity, or is a congenital anomaly or birth defect. Other situations that require a causality assessment include events occurring above the expected rate or of unusual severity, and signals generated as a result of individual or clustered cases, as these could signify a potential for large public health impact. In addition, the review committee can decide to include AEFI that may have been caused by immunization error, significant events of unexplained cause occurring up to 30 days after vaccination, or events causing significant parental or community concern. Next, prepare the documentation needed for the causality assessment. This involves gathering detailed information on the AEFI, including a completed AEFI case investigation, all case details including laboratory and autopsy findings, a valid diagnosis for the AEFI, which could be an unintended sign, an abnormal laboratory finding, a symptom, or a disease, and identification of all vaccines that were administered before the event. All this case information will be used to determine the most likely cause of the AEFI. If any of these details are missing, the review committee may not proceed with the assessment or may deem the case unclassifiable. Based on the results of the causality assessment, you may need to take actions to prevent the AEFI from happening again. Follow the standard protocols for responding to AEFIs that are recommended by your national program. How you respond depends on the most likely cause of the AEFI. The AEFI could be classified as a vaccine-related reaction, an immunization error-related reaction, or a coincidental event. If there is a higher reaction rate than expected from a specific vaccine or lot, the AEFI may be caused by the vaccine. Obtain information from the manufacturer and consult with the WHO country office. You may be asked to withdraw that lot, conduct an investigation with the manufacturer, or obtain the vaccine from a different manufacturer. If the AEFI was caused by an error in your immunization program, correct the cause of the error. You may need to correct any logistical issues for supplying vaccines, change procedures at the health facility, train health workers, and Intensify supervision. Continue to monitor these changes to make sure the error has been fixed. In some cases, the AEFI may be coincidental, meaning the vaccination coincided with an unrelated illness or there was a chance temporal association between the event and vaccination. In this case, you as the supervisor will need to clearly communicate these results to the community. You may need to work with communication experts to develop strategies and clear messages. It will be critical to present evidence to show that the AEFI was not related to the vaccine or an error in vaccine handling, prescribing, or administration. Remember that losing the public's confidence can have a devastating impact on your immunization program. You now know how to support a causality assessment after an AEFI.